Hello, everyone. Welcome to Chat with the Editor. My name is Max Olupoku, Assistant Editor of Social Media, AJR. And today I'm excited here to be joined by Dr. Stephen Hetts, who is a professor of radiology at UCSF and a member of the editorial board, AJR. It's an honor to have you here, Dr. Hetts. Thanks for joining us.
Thanks so much. Glad to be here.
All right. Would you like to tell us about yourself and your educational background?
Sure. I grew up in California and then I went to Harvard for college and medical school, and then came back out to Stanford for internship, and then did my radiology residency, my diagnostic neuroradiology fellowship, and my interventional neuroradiology fellowship, all at UCSF. And then I joined the faculty after I did all that.
Amazing to hear that. Okay, so why neuroradiology?
I've, for a long time, been very interested in the brain and its function. When I was growing up, my mom actually was diagnosed with Parkinson's disease when she was relatively young. And then when I was in college, I had the opportunity to spend a summer with some of the radiologists at UCSF who had really pioneered the field of interventional neuroradiology. And so that early exposure sort of directed my career path. In medical school, I was deciding between neurology, neurosurgery, and neuroradiology. And I decided that neuroradiology was sort of the perfect balance of imaging and intervention and patient care. And so I sort of ended up right where I started.
Wow, that's amazing. So, what's the best thing about your career as a neuroradiologist?
What I really like about being an interventional neuroradiologist is that I get to have a one-on-one interaction with the patients who I treat. And it's particularly rewarding when those are more than just sort of an episodic treatment. And so, although I really enjoy treating, ruptured brain aneurysms and strokes and traumatic injuries, which are sort of acute emergencies, what I've found over the course of my career that I really like is seeing people who come back more than once. And so some of those folks are particularly in our interventional neuro-oncology practice, infants who have retinoblastomas in the eye and will deliver intraarterial chemotherapy to the ophthalmic artery. And to see those kids have their tumors regress and grow up has been great. And then we have a large clinic for hereditary hemorrhagic telangiectasia patients here at UCSF that I lead along with one of my colleagues, Miles Conrad, in body interventional radiology. And so we get to see these patients all throughout the course of their life and help manage blood vessel malformations in their brains, their lungs, their livers. And since it's a genetic condition, we actually get to take care of multiple members of the same family, which has also been a real point of pride in my career. And I've enjoyed getting to work with multiple members of the same families.
Wow, that's great. Good to hear all that. Okay, so as an editor of AGNR, can you tell us about your role?
Yeah, I help lead the neurointerventional section at AJNR. And in that role, I have the privilege of getting to work with two really talented associate editors as well, Christine Blackham and Maxime Shapiro. And we, as a three-person team, get to review the submissions regarding neurointerventional papers to AJNR. And a lot of what we review is vascular related or neuro-oncology related. But it's really quite a wide array of things that focus on the interventional aspects or the imaging aspects or some of the management aspects. And then when we've taken an initial look at those, we will send some of those papers out to our peer reviewers, and that's a talented group of people really from all over the world. And once we get the information back from them on their evaluation, we'll then sort of summarize it and make a decision about the paper and then reach back out to the authors. And if it's unfortunately something that's not great for AJNR, we tell them that. And if it's something that might fit well in AJNR, then we work with them during the revision process and ultimately try to publish things that we think will be impactful in the literature and helpful to our readership.
Okay. All right. That's great. So, do you have any advice for writers?
I think in writing academic papers, it's always really helpful to have a clear message and be very clear about what the points are that you want to make in your paper and try to highlight those, particularly in the abstract. Because not so much during the review process, because we'll look at everything, but definitely once a paper gets out there into the medical literature, a lot of people are very rushed for time. And so they'll just look at the abstract. And so I would take special care about one's abstract to make sure it really encapsulates what the key points of the paper are that you want the reader to walk away with. And similar to that, I would say the title matters too. And it's helpful to have a title that clearly identifies what the main point you're trying to make with the paper is. Obviously, in addition to that, a well-written paper goes very methodically into the materials and methods, how the data was generated, is succinct, is not super long, ideally, and has figures and images that support the points you're trying to make. And I think most people who submit to AGNR really do submit really excellent work. So I've been pleased with the manuscripts that have come forward so far during the last few months while I've been in this role.
Okay, that's a great one. All right, so let's say that an author has a question concerning a paper. How do you recommend they proceed?
Depending on what the questions are, some can be directed at our editorial staff. So Karen Halm is the staff member from AJNR who works most closely with us. If it's a more detailed question, often she will forward that to us and we can, among the editors, sort of address it. And if there are other questions that authors have, they can always reach out to us directly by email if they'd like. But often going through Karen is the easiest because a lot of the things that folks ask about actually are more technical things that have to do with the journal as opposed to topical things that the editors would be more familiar with. So typically I recommend starting with Karen. And then if that isn't exactly what the authors were looking for, they can certainly reach out to me or to Christine or to Maxime.
Okay, that's very great. Thank you for the amazing work you're doing for AJ now. All right, so let's go to some funny questions. If you had not gone into medicine, what would you probably do?
It's a really good question. I'm not entirely sure what I would have done. I might have got into politics or something like that. I find that as I've gone through my career in the University of California, I've had to become very familiar with the way administrative systems work and how you get sort of policy changes done. And so I guess the closest analogy is politics, although I know that has a bad name in America these days.
Okay, all right. And do you have any advice for future radiologists?
Yeah, radiology is a fantastic field, so congratulations on choosing it as a field. And I would say radiology is tremendously diverse, both in its people and in the topics that it can cover and the kind of work that you can do. So again, I as an interventional neuroradiologist really have a lot of one-on-one contact with patients and operate on them and follow them for long periods of time and use imaging as part of my practice and how I understand the results of my treatments, for example. But equally, there are folks who do pure diagnostic radiology or some hybrid where they have sort of a clinical practice where they're seeing patients, but then also do an imaging component. And what's nice is that radiology as a career allows you all those many choices, and you can change that over time. Your first job isn't necessarily your last job. And if you want to do something different, you can often do that within radiology. It's not like you have to completely switch fields. So again, I would just commend folks watching this. If you've chosen radiology as a career, that was a great choice.
All right, that was a great advice. So, what is something about you that people don't know? Or maybe I should put it, what do you like to do outside of radiology?
Sure. I'm married to another radiologist. She's a body interventional radiologist, Glory Huag at Stanford. And we have two kids, one in college and one in high school. And so, we enjoy taking family trips together and travel. Um, but, otherwise pretty low key stuff. Living in the Bay Area is a pretty nice thing. And we have extended family here. And so a lot of that is just sort of quiet at home activities.
That's amazing. And the last question, do you have a favorite radiology sign?
So my favorite radiology sign is one that's very specific to neuroradiology and to neurointerventional, and it's the so-called ghost sign, which basically is on a CT scan in particular. You can see the outline or ghost of a ruptured brain aneurysm outlined by the denser subarachnoid hemorrhage. So I like that one.
Thank you very much for joining us, Dr. Hetts. It was great, so much, so great having you. Thank you.
My pleasure. Thank you, Maxwell.